An Ipsos survey has found that almost half of South African households went without food due to COVID-19. This means that millions of malnourished South Africans may suffer severe illness if a third wave of the COVID-19 infections hits South Africa because of their weaker immune systems. Sandy Bukula, who is the Interim CEO at Operation Hunger, joins us now to discuss the realities impeding South Africa's nutritional reliance. Sandy, it's always a pleasure to see you. Thank you so very much for joining us here on SABC News, ma'am.
Thank you so much, Flo, and thank you for having me.
As a start, the survey made quite a scary discovery, finding that, almost half of South African households went without food due to COVID-19. I'd like to talk to the issues that contributed to this. Was it, for example, the fact that people couldn't, in fact, go out and work, particularly those in informal sort of work structures? And also, on the back of that, if you can talk to us about, how the survey was conducted and how you ultimately got to that figure that indicates that almost 50% of households in South Africa went without food.
Flo, basically the survey was taken by the integrated phase classification for food security for South Africa. So what they've done is they've sampled and did the survey in according to each, basically in each country, in each province. And each province, what they did was they did the relationship between the economy status, the health status, as well as the hunger status. And they classified it in accordance to, people that would be, under a crisis, emergency, and just only under stress. So it had 5 categories. And what was very interesting to see that the outcome was that, of our top 3 already having societal issues and economic issues provinces, which is the Eastern Cape, KwaZulu-Natal, as well as Northwest, came out the highest on all of those 3 indices. So, for example, with KwaZulu-Natal, Eastern Cape, and Northwest, the impact on the income, on the loss of income, it came up to above 60%. Yeah. And the suffering from illnesses and of stress and other illnesses came up to also, above 60%, as well as basically the hunger scourge, which has been, they were all recorded under emergency and they were all going on to a crisis. And all those figures go up from, between 51% to 58%. Within those 3 provinces. So you can already see the linkages and the patterns, that are masking the significances within those type of populations as well.
Yeah. I would imagine that, when people are going hungry, this also then affects, their ability, their health and their ability to fight off certain illnesses. We're dealing with a pandemic, we're dealing with the coronavirus. Mm-hmm. The question I need to ask now, and as you know, it doesn't sound very, very nice to ask, but, how much did it impact on, people's lives? Were people dying due to not only the fact that you are on one side dealing with coronavirus, but the fact that there literally isn't any food? And I wonder if that might have also then caused the numbers that we're seeing to kind of spiral the way that they did. Was the issue of hunger a direct or causal link to some of the deaths or numbers that we saw of coronavirus? Because I'm assuming you can't even, your immune system is down because you're hungry and all of that. So I'm wondering if these are all factors that play a role together in the end.
That's correct. COVID-19 and hunger has been the biggest drive to basically the drive of these numbers. We have also noticed over the past 8 months that the pricing in food, the food pricing and food accessibility has increased by 30%. And this increase has been on your stapled food. So you can only imagine that already people are currently on remittances, are currently on loss of jobs, currently, on reduced salaries, that basically so they literally under they're under the limit of actually being able to survive and carry on currently. So yes, those numbers definitely were impacted by hunger, and that direct relationship between the hunger and illnesses has actually been continuously happening, because I think Flo, you would remember before the COVID-19, and that was in 2019, we were reported to be making a small amount of improvements within in malnutrition and in undernourishment, but we hadn't actually reached all the 10 targets. So you know what I mean? So now all of those gains that were made prior to COVID-19 basically have been reversed, as one of the part of it is your societal, economic, and also the environment issues that have impacted that drastic change.
And Sandy, I'm glad you spoke about food accessibility, and I think this is something you and I have kind of spoken about before, and I just wonder, you know, on the government side, if there's anything that needs to be done or can be done to sort out this issue of food accessibility. I mean, it's interesting that we have these surveys, we have people like you who are monitoring, you know, the levels of hunger in the country, and I wonder if these are then taken to the next level at a national level where something can be done about it. I mean, when we spoke about food accessibility the last time, we're saying that, you know, something needs to be done to deal with the issue of food accessibility. Is there any maneuver in terms of, in fact, actually doing something about it? I mean, it really is scary that, you know, I look at these numbers that have been presented by the Ipsos survey, and the fact that it's, you know, almost 50% of people in our country going hungry. I mean, that's really quite scary.
This is really quite scary. I mean, I think the climate emergency just makes it very critical to rethink food systems in the country. I know, for example, that you know, like the big retail chains that sell food at the moment are currently looking at different programs, you know, to try and assist, and you know, and other food actors are at the moment trying to relook. But I think the biggest thing really that we need to shift drastically is that we need to be looking at these approaches you know, in an equitable lens, you know, and we need to look at basically the relationship between food system as well as health systems. I mean, you do know, you know, like from the previous budget already, also for 2021 to 2022, that was presented by the government, that it's only just a small portion of the budget that was basically directed at nutrition equity. And that is a problem, because if you had to look at it, if we would have mainstreamed, you know, nutrition into health system and currently existing health systems right now, that would actually have, that would be very, you know, like low cost effective, but it would have a higher long-term impact, because, you know, you will not only be looking at just addressing the issue, you know, at the end result, but you would be looking at a preventative, you know, curative measures that basically facilitate, you know, nutrition into entire health systems, you know, for people and for all people to have a universal access to them.
Yeah, and of course the biggest issue, of course, now that we're talking about is whether or not you know, we'll have, you know, another resurgence, what some are calling the third wave. What can you tell us about South Africa's nutritional resilience ahead of this third wave, possible third wave? Yeah.
Well, I mean, both ourselves with our anthropometric surveys as well as our nutritional surveillance surveys, we agree with the IPC as well, to say that, you know, there is going to be an increase basically on those numbers, at least by between 15 to 20%. And the reason for that is because, you know, like the major drivers that have been pushing these gaps has been, you know, like financing, you know, of nutritional packages and nutritional programs. Also, it has been basically COVID-19 and the restrictions, the loss of jobs, you know, like the food pricing increases as well as the drought, you know, and so all of those things haven't really been looked at and addressed holistically. So instead, I mean, we're just having an increase in all of those and an overabundance of that increase. So that will directly basically, you know, relate in the numbers increasing. Yeah. And that's what we actually are at the moment sitting and we are looking at.
Yeah. All right, Sandy, it's always a pleasure to see you. Thank you very much for giving us your time as always, ma'am.
Thank you so much, Flo. Have a great evening.
Thank you. Right, that's Sandy Bukula, who is the CEO of Operation Hunger. They're talking to us about the Ipsos survey that recently came out, finding that almost half of South African households went without food due to COVID-19. Very scary to hear that indeed. All right, well, the safety of the elderly in the country